Welcome to another video about key figures in hypnosis and also psychotherapy. And the name that I would like to drop today is Sigmund Freud. Now, I know what you are saying, but Pedro, why are you saying Sigmund Freud as a key figure in hypnosis? He is the father of psychoanalysis. Dr. Freud is important in the field of psychotherapy. Well, that's true. However, Sigmund Freud is also important to the history of and the clinical application of hypnosis, and also her downfall. So, Sigmund Freud, as all of you know, was a physician, and he studied for a long time, certain pathological aspects of the human mind and the human body. But as fate would establish, Freud wasn't too kind of certain medical specialities. For example, Freud was not really comfortable with blood and treating people with serious injuries. So he most of his medical career was research based. In that sense, Freud happened to achieve a scholarship in Salpêtrière Hospital in Paris, France. In that time, one of the major names and one of the responsibles, the major responsibles for the Salpêtrière Hospital, please forgive my French, was Dr. Charcot, Jean Charcot, who was a well-known neurologist and one of the first persons that tried to explain hysteria or the hysteric disorder. And one of the main theses of Dr. Charcot was that hypnotism and hypnotic phenomenon and hypnotic suggestibility were tied to hysteric symptoms, hysteric disorders. So, in Charcot's mind, only the truly suggestible persons or the suggestible patients were highly hypnotizable. In that sense, Charcot would frequently utilize hypnosis as a means of intervention and also demonstration of hysterical symptoms. He was very known for his Thursdays or Tuesdays nights, where in Salpêtrière Hospital he would arrange glorious demonstrations with a lot of colleagues and physicians and that he would demonstrate hypnotic phenomena, and also that he could transform hysterical symptoms. For example, he could regress hysterical symptoms in one patient or transfer hysterical symptoms to another patient. A lot of years passed, and the early assumptions of hysteria from Charcot were debunked, and also his demonstrations, because as time progressed, history learned that those demonstrations were not only what they seemed. The patients were prepared earlier, and some of them responded in the established in the way that Charcot wanted, because they realized if they responded in that manner, they would get certain benefits. So truly, they were responding to an authority figure. Notwithstanding, Charcot was a major influence in Freud, not only in the hypnotic and psychotherapeutic side, but also as a person. Freud admired Charcot's confidence and Charcot's posture, because Freud was a very shy person and a very anxious person. When Freud returned to Vienna, Austria, he would establish his practice early with the uses of hypnosis. He and his colleague Joseph Breuer utilized hypnosis frequently in their approach to hysteria. As the time went by, and Freud started to develop his early thoughts and his early ideas into psychoanalysis, he continued to utilize hypnosis in his intervention. But his ideas were spawned, and he started to integrate them with the use of hypnosis. And that's why a lot of psychologists refer to hypnosis as a psychodynamic approach, as something that is psychoanalytical in foundation. But hypnosis pre-existed or predates psychoanalysis, because other important figures would already doing psychotherapy with hypnosis. For example, Hippolyte Bernheim would apply his suggestive therapeutics with that was an approach really similar to cognitive therapy and behavior therapy nowadays with hypnosis. Notwithstanding, the ideas of Freud started to attract the attention of some, and also the the rage of others, because the medical community really saw Freud's ideas as lunacy, as that wouldn't make sense with the medical community, with medical research. But Breuer really started to get more interested in Freud's ideas. So interested, in fact, that Breuer proposed to Freud to intervene with a patient that Breuer couldn't, or his therapy wasn't going so well. And that patient was Anna O, the really famous case of Anna O. So, as Freud started to work with Anna O, initially with hypnosis, the sessions passed on, and they were in Freud's way, and Freud was trying to get to more unconscious material, really more insights. And at some point of the treatment, at some point of the sessions, Freud began to get afraid, or to felt fear from the counter transference and the intense transference that the hypnotic state produced into NO and other female patients. it wasn't uncommon for a lot of patients to start to grab and to try to hug and kiss Freud after sessions. So Freud was afraid of that, and Freud concluded that hypnosis and the hypnotic state produced an intense sexual and love transference, countertransference. So Freud decided to abandon hypnosis by creating other approaches, like, for example, free association and the interpretation of dreams. Really, Freud started to do what he did with hypnosis, but without hypnosis, in dream analysis and free association. When psychoanalysis was born, the first essays on psychoanalysis, uh, Freud was convinced that the origin with was established and was linked to sexuality, something that Brower didn't agree on. So Brower and Freud split. It was very well. It was really public dispute. It was an ugly dispute, and Brower was systematically erased from history because of Freud and his followers. And with with regards to hypnosis, Freud um, Freud would say that hypnosis was not an appropriate tool to be utilized in psychoanalysis. So, someone who was a psychoanalyst or an analyst or a psychodynamic therapist would have to abandon hypnosis because hypnosis was prejudicial to the psychoanalytic relationship. However, Freud wrote a series of articles about hypnosis when he utilized hypnosis. So these books and these articles exist. So Freud utilized hypnosis. Uh, a lot of other clinicians like Jung, like Erika Fromm, like Louis Wahlberg, and other psychoanalysts continue to utilize hypnosis as as a therapeutic tool with their psychoanalytic approach. That's why nowadays when we utilize hypnosis with a psychoanalytical approach, we say that we are actually doing hypnoanalysis. And if you think about regression style therapy, uh, those kinds of therapies are very influenced by psychoanalysis to regress to pre-existing trauma to another time, to another emotion, and to really reactivate it so a catharsis would appear, and then the patient would attribute another meaning to that catharsis, to that situation, and the symptom would disappear. The problem would fade out. So when someone does regression style therapy, they are really doing something that is uh, most well, psychoanalytical um, really psychoanalytical approach or influenced by psychoanalysis. Sorry for that. This is live TV. So, Freud was an important figure in hypnosis and psychotherapy for obvious reasons, and hypnosis for not so obvious reasons. But Freud was one of the first therapists that brought hypnosis to clinical settings, to clinical practice. But he was one of the first clinicians to abandon and to establish hypnosis as a bad thing. So he boosted and he destroyed hypnosis. The same person did both of them. So that's my video on Freud and hypnosis and his relationship with hypnosis. If you like these contents, please subscribe, please share. I hope you all be safe, and I'll see you next time.